HIV is a virus that can affect anyone. And although it's a very well-known disease around the entire world, there is a large percentage of the population who wrongly believe that they cannot get infected. Therefore, they never get tested. Unfortunately, this belief is wrong, given to the fact that anyone who practices unsafe sex, anyone who has multiple sex partners, and anyone who does drugs intravenously, and anyone with poor education can be a victim. Besides, according to the Center of Disease Control and Prevention, around 1/4 of individuals infected with the virus are unaware that they contracted the disease. Testing for AIDS is not only important for you, but for the rest of the society as well. There is no way we can eliminate HIV if around 65% of the adult population do not know the current status. And the only way to know this is by taking the test. And if a person is found to be HIV positive, safer precautions will be taken into account, not only to assure the well-being of that individual, but also to avoid the spread of the disease. Furthermore, even people living with HIV have to be tested at least twice a year. Once, to check the amount of virus that they have in their system, and two, to see how well she or he is reacting to her treatment. Now, we're going to talk about the different type of testings. Luckily, due to the technology and medicine advances, we have different tests that can be done in order to see if a person is seropositive or seronegative. And among the most popular tests that we have ELISA and Western blot, which checks for the antibodies of the virus. We also have a different test, which is polymerase chain reaction, which checks for the amount of virus itself. However, these tests are done in facilities where they have the right equipment and resources to do it. But there's a test that you can get over the counter at any pharmacy, which is called Aura Quick. This test also checks for antibodies and has 99% of accuracy. To use it, you only have to get the test swab and then swipe it once in the upper gum, then once in the lower gum. Then you're going to put it inside the test tube provided, and then you will have your answer within 20 minutes. To find more information about it, you can always go to auraquick.com. Next, we're going to talk about the different places for testings. In the United States, there are a lot of locations that offer that service at a low cost or even for free. Many hospitals, medical centers, drug abuse programs, and organizations such as the American Red Cross offer these options. Besides that, if you want more information about the virus and where to get tested, you can always call 1-800-232-4636. Or if you prefer to visit online, you can go to gettested.cev.gov. Now, last but not least, if you or any person that you know have any questions about the HIV virus, you can always go to either cdc.gov or hiv.gov. Human immunodeficiency virus can be drastically reduced if the necessary precautions are taken. And getting tested and encouraging others to get tested is one of the most important steps into winning the fight against this deadly disease. Thank you.
Recognizing the symptomatology caused by an HIV infection is very important in order to treat the disease as soon as possible. A prompt treatment in the first 72 hours can actually eliminate the virus, keeping the disease from progressing to a status in which it is incurable. Clinically, the disease is divided in 3 phases. First, an acute phase in which the patient may experience flu-like symptoms. Then a clinically latent phase in which the patients are asymptomatic. And finally, the AIDS phase, in which the patient's immune system is so weak that the patient cannot fight opportunistic infections or cancers. And in this stage, these associated diseases can end the patient's life. In the acute phase, the first 2 to 6 weeks of the disease, the patient may suffer fatigue, fever, sore throat, sore muscles, occasional diarrhea, and or lymphadenopathy. These symptoms can range from mild to severe. However, since they are unspecific, the patient might not suspect of HIV, and because of that, they will not get tested. If you are in risk of getting HIV, or if you are a health professional, it is very important to recognize these symptoms as indicators of the beginning of the disease. After the acute phase, after these 2 to 6 weeks, most patients are going to remain asymptomatic. Maybe they have the false impression that they are cured and that the cause of their post-illness was a non-specific viral infection. Actually, what happened is that the virus continued its replication and continued the gradual depletion of CD4 T cells. This stage lasts an average of 10 years. In this period, the patient may experience lymphadenopathies, weight loss, night sweats, and fever. However, like I said, most of them are completely without signs or symptoms. Eventually, since the virus replication never stops, the patient's immune deficiency becomes so profound that the patient suffers from repeated opportunistic infections, malignant complications, and neurological disorders. At this point, the patient is considered to have AIDS. Also, the patient may have chronic fever and extensive diarrhea. This diarrhea can cause a dramatic weight loss and weakness in the patients. The most commonly observed opportunistic infections are pneumocystis pneumonia, cryptococcosis, and thrush or candidiasis. Malignancies related to viral pathogens like Kaposi sarcoma are the ones that are present in this stage of the disease. This sarcoma is recognizable by its characteristic lesions. These lesions are patches of red to violet on the lower extremity and the back, which eventually can become purplish brown nodule. Although AIDS may be fatal for some patients, with the current with the current treatment of antiretroviral, the immune system of HIV-infected patients can be maintained healthy enough to avoid these conditions, to fight the opportunistic infections. Therefore, it is of great importance for patients and for physicians to know how to recognize clinically this incurable but treatable disease in all its phases.
As of 2015, homosexual and heterosexual contact combined made up 91% of all HIV diagnoses. This makes sexual contact the most common form of HIV transmission. HIV can be transmitted through the bodily fluids of an infected person, such as semen, vaginal, precum, and anal mucus. During unprotected sex, the HIV and bodily fluids of an infected person can pass into the body of a sexual partner either through the mucous membrane of the penis, vagina, or rectum. It is important to know that those infected with an STD are 3 times more likely to get HIV through unprotected sex with an infected partner. This is because the STD causes irritation on the skin, resulting in breaks or sores that make HIV easier to enter the body. Even with STDs that do not cause breaks or sores in the skin, the inflammation that it causes increases the number of cells that can be considered target cells for HIV. Those with an STD and HIV are also 3 times as likely to spread HIV through sexual contact due to an increased concentration of the virus in semen and genital fluids. The riskiest type of sex for getting or transmitting HIV is anal sex. While it's risky for both the receptive and insertive partner, the receptive partner is actually 13 times more likely to become infected. This is due to the fact that the lining of the rectum is very thin and prone to tearing, which allows for HIV to more easily enter the body. In the case of the insertive partner, they may become infected through the urethra or through small cuts or open sores on the penis. Vaginal sex can also lead to the infection of both males and females. Women are susceptible to HIV through this form of sex because HIV can enter the body through the mucous membranes in the vagina and cervix. Men are also able to become infected this way because vaginal fluid carries HIV, and men would become infected the same way that they would during insert of anal sex. The least risky type of sex is oral sex, which has little to no transmission of HIV. There are many ways of reducing the risk of transmission and infection during sexual activity. First of all would be abstinence. But if you do choose to be a part of sexual activity, condoms are highly effective in preventing HIV as well as other STDs when used correctly. Latex condoms are the most effective, and while plastic condoms can be used when a latex allergy is present, they are more likely to break. Using water or silicone-based lubricants are a way to prevent breaking of the condom or tearing of any tissue during sexual activity. It is important to note that condoms made out of natural membranes such as sheepskin do have small holes that will prevent them from blocking HIV or STD infections. It is also important to note that oil-based lubricants can actually weaken latex condoms, increasing the chances of the condom breaking. Lubricants containing nonoxynol 9 should also be avoided as they can cause an irritation of the vagina and anus, increasing the risk of getting HIV. Last but not least, there are also medications available to HIV-negative individuals that are taking part in sexual activity with an HIV-positive individual. Pre-exposure prophylaxis can reduce the risk of infection through sex by over 90% if taken daily as directed. The risk can actually be even lower when combined with the use of condoms. HIV-positive individuals can help reduce the risk of transmission by taking antiretroviral medications. This would decrease the viral load in an infected individual, making it less likely to cause infection in a sexual partner. Like with PrEP, it is important to use this in combination with condoms for an even lower risk of transmission.
In the U.S., injection drug use now accounts for nearly 1/3 of the new AIDS cases. Commonly, people share the needles after they inject the drug into their vein. The next person uses the same needle to inject the drug, which means blood has been shared. If the first person was infected, then there is a high chance that anyone who uses this needle will become infected as well. One approach that helps the risk of infection among drug users is syringe exchange programs. Syringe exchange programs have been established widely in some developing countries and a majority of the developed countries. Politically, it has been determined that these injection exchange programs encourage drug use, when in reality, several studies have proved the opposite. The needle exchange programs not only reduce the risk of contracting HIV, it also is far cheaper than the lifetime cost of treating HIV. The program gives a clean needle with every dirty needle that is brought in. They have a no questions asked policy, which seems to improve the amount of drug users that participate in this program, resulting in a decrease of dirty, used needles in our streets. The clinics also become another place where individuals can be tested for HIV. These programs create an opportunity for people to get the treatment and help they need. The clinics that provide clean needles also offer the emotional support that is needed for the rehabilitation of a drug user. Without these programs, these individuals usually have no one to help them. Some have been kicked out, abandoned, and left helpless. Given the psychological burdens and barriers with drug use, these individuals need an opportunity to not add another stigma to their lives. Another way of preventing transmission through sharing of needles is self-cleaning the needles. Thoroughly washing the needle twice with bleach and twice with hot water can help lower the risk of infecting the next person who uses the same needle. Every step researchers, teachers, and health providers have taken has been to help control the continuous spread of HIV. It is important to step back and look at the big picture. When it comes to funding injection exchange programs, one must put aside personal beliefs in order to see that if it reduces the chance of transmission, it's worth it.
Living with AIDS is tough, but it's not impossible. AIDS affect the quality of life of people, and is not necessarily for the best. Living with AIDS is tough, but it's not impossible. AIDS affect the quality of life of people, and is not necessarily for the best. There are many reasons why living with AIDS is pretty rough. According to a measurement tool called ProCall HIV, which stands for Patient Report Outcomes Quality of Life, by the journal Acquired Immune Deficiency Syndromes, report that people living with AIDS suffer from emotions, they suffer from social relationships, and they also suffer from limited physical activities. And we're going to go more into details into this later, but these are generally the main reasons why dealing with AIDS and living with AIDS is generally pretty tough. Where people who have AIDS normally deal with the symptoms and the side effects, but people forget about the psychological role that AIDS have, the toll that AIDS have on people. So we're going to be talking about these more in depth. So emotions. Emotions, one of the main reasons why dealing with AIDS and living with AIDS is generally pretty tough. You tend to have a negative perception of yourself. You tend to have negative emotions all the time when you have AIDS. When you have AIDS, you tend to have a feeling of guilt. You think that everything is your fault. You start to blame yourself for everything. You blame yourself for getting the virus. You think that you might have transmitted the virus to someone else. So you're always down on yourself. You also tend to have feelings of shame, inferiority, and embarrassment. And right now, AIDS in modern society is something that is frowned upon. And here you are thinking that, you can't meet someone because you think that you're below people. You think that you're the minority, and that's not a very happy feeling. And you are embarrassed to disclose your information, your status, whether you have AIDS or not, and you're embarrassed of that. You also feel shame because nowadays people frown upon older people having AIDS, and this is something that people try to cope with, and it's generally pretty tough. So the second reason why living with AIDS is generally pretty tough is because the limitations of physical activity. When you live with AIDS, your body tends to be a little bit more weaker. You are fatigued, you have less energy to do things, and this is because your body is constantly trying to fight out the virus. When your body does this, that means you have less minerals in your body, you have less vitamins in your body, then it means your body is generally pretty weak to do day-to-day activities. This is all helped with medicines, of course. Another very important thing is sleep. According to ProCall, patients report that they have trouble sleeping because of the pain of AIDS. AIDS causes pain in your body. You have the brown, purple blisters in your back and patches, and they generally cause pain. And you have fever and stomach aches, and due to this, it keeps up the people living with AIDS awake at night, and this does not let them get enough sleep. And patients and people living with AIDS also report that at night they can't sleep because thoughts start popping in their heads. All the emotions that we talked about earlier, they start to think about it. They start to think that they are that they're shameful, that they are the minority, and they are embarrassed, and they are guilty, and they're just generally thinking of these bad thoughts, and these thoughts keep them up at night, and they get anxious, and it doesn't let them sleep. So they lose sleep, and then it's a cycle. Since they lose sleep, that means that they get less energy, and that energy is used to fight off the virus, and then that means your body is generally very, very tired, and you just don't get enough energy to perform day-to-day activities. And this is why living with AIDS is generally pretty tough. So the third reason why living with HIV is pretty tough is because of social relationships. The people living with HIV fear transmitting the disease to others. They fear loneliness and rejection. The people living with HIV think that people look down upon them, and because of this they are afraid of going out there in the open and meeting new people and forming new relationships with new people, because they're afraid that once they disclose their status of HIV positive, that people will look down upon them and reject them. This fear of getting rejection stops people from going out there and making new friendships, trying out new things, and living life the way they used to. So what can be done? It is recommended that patients living with AIDS disclose their status with their partners. This is done to reduce the likelihood of transmitting HIV to your partners. This also helps communicate with your partners, which increases the likelihood that you guys will be more healthier and happier. Treatment and medical care is also something that is recommended to those living with HIV. This treatment is called antiretroviral therapy, known as ART, and what this does is it keeps your immune system healthier and it slows down the progression of AIDS. If you take this every day, then you are more likely to live longer and live healthier, and then this also reduces the chances and the likelihood that you will transmit HIV to your partner. Another type of medical care is the viral load test. This measures the amount of virus in your blood. This is done to track the progression of your disease, your HIV. Using condoms the right way and having your partner take medicines such as PrEP also reduces the chances of transmitting HIV even more. These medicines help people live a safer, longer, and a happier life than they normally would back then without medicines. With this treatment, it helps people live their life the way they used to.
AIDS and HIV was a devastating epidemic. There is still much to learn. Infection rates are surprising, and the deaths even more so. Many advocates have raised some awareness to this murderous virus, but still to this day many people do not know about this disease that targets all. After listening to my colleagues, I'm sure you would want to know about how you could help out. The first thing you could do is what I'm doing right now: educating and talking about AIDS or HIV. Talk to friends, neighbors, co-workers, and family. Exemplify the gravity of the situation and how important it is to be tested for HIV or AIDS, especially if someone is at risk. Also explain precautions when someone has a sexual partner who is HIV positive. Or if you aren't a big talker, you could just show them this video. Not only will this increase the public's education, but it will also decrease the stigma against the disease, the people with it, and testing for STDs. And with that, less people will be afraid of a diagnosis or infection, and more people will be cared for. Also, spread the word on safe sex. This is a big help to the community in decreasing infection rates for any STD. Another way you can help is through supporting, volunteering, or donating in affiliation to AIDS HIV organizations. Several organizations exist across the globe. Some notable ones include the Global Fund, the Treatment Action Campaign in Cape Town, South Africa, the Rush Foundation, and UNAIDS. In the US, there is the Center for AIDS Research at the National Institute for Health, the Elton John AIDS Foundation in New York and London, and AMFR in New York and extending to the world. In Southern Florida, there is the Broward's House Incorporated, the Campbell Foundation, the Family AIDS Coalition, League Against AIDS, Island Coast AIDS Network, and AIDS Help Incorporated. These organizations may also help those who cannot afford the treatment for HIV or AIDS, and may create awareness of the importance of the disease to political officials and drug companies. Getting involved with these organizations or referring those who need the information to them is a big help. And together we can eliminate this virus. The information of each organization to find help will be stated now. The first organization mentioned on the list was the Global Fund. Here's the information. It's located in Switzerland. This is the phone number, and this is the website in which you can access for more information. The second organization is called the Treatment Action Campaign, and they are located in Johannesburg. And this is the phone number, and this is the website for more information. There's also the Rush Foundation, which is also an international organization. They are located in the UK, and this is their website. UNAIDS, they're very famous for their worldly affairs and help in Africa. Located in Switzerland. This is the phone number, and this is the website. This is the information for the Center for AIDS Research. This is the information for the Elton John AIDS Foundation. These are in America, in the US. And we're moving on towards South Florida, the Broward House Incorporation, the Campbell Foundation, the Family AIDS Coalition, the League Against AIDS. This is more centralized. And this one's in Fort Myers, the Island Coast AIDS Network, and the AIDS Help Incorporated, which is located in the Keys.